Hi, my name is Allison and I am a student with Nightingale College, and today I am doing the intradermal injection video. So here I have all of the supplies I will need. I'm going to check the provider's orders to see what I have for my patient. And I'm going to double check my 6 rights and medication, which is the correct patient, correct drug, the correct dose, the correct time, the correct route, and the correct documentation. So I'm just going to compare the EHR and the doctor's order. They have ordered the tuberculin, 5 TU per 0.1 mLs. So that is what I'm going to be preparing today, and it checks out with the mark. Okay, so after I have all my stuff, I am just going to have it with me. I'm going to knock on my patient's door, wait for them to welcome me in. I'm going to come in, close the door and or curtain behind me for patient privacy. Hi, my name is Allie. I'm going to be your nurse today. What is your name and date of birth? Okay, I'm just going to check your wristband and double check that. Okay, Mr. Smith, today we are injecting you with some tuberculin, and that is to see if you have been exposed to tuberculosis. So what's going to happen is I'm going to drop the medication. It's going to go right into your arm, and then if you have any effects to it, it will show if you've been exposed. Some side effects from the medication that you could experience is swelling and itching at the site. That includes when the injection is actually happening. There could be a burning sensation, but that is all normal and common. Some adverse side effects that you might experience is shortness of breath and hives. And if either of those happen with you today, I need you to let me know right away, okay? Do you have any questions for me before we start? No? Okay, perfect. So I'm gonna perform some hand hygiene. Going to put on some gloves. Okay, just gonna check and make sure I have the right medication once again, the tuberculin. And then I'm gonna clean the top with an alcohol wipe. Perfect. Okay, and then I'm going to get my syringe. I'm gonna double check that it's the correct safety syringe. It is 1 ml for the amount, 25 gauge, 5 and 8 inches needle size. So I'm just gonna open this up. Alright, now the order I need to draw up is 0.1 mLs. So I'm gonna go ahead and do so before I insert my needle into the vial. I have pulled up 0.1 right there. And then I'm going to take off the cap, inject the needle, push in the air, then I'm going to flip the vial and drop my medication. And if there's any air bubbles, get those air bubbles out. Awesome. Okay, 0.1, and I'm going to scoop back up my cap with the one-handed method. Okay, there I have 0.1 of my tuberculin to give to my patient. Okay, Mr. Smith, I'm just gonna check out your arm real quick. When you pick a site for a patient's injection, you wanna make sure it's at least 3 to 4 fingers below your inner elbow and about a fist up above from the wrist. You're going to look in here and you're going to palpate it, look for any discoloration, any signs of cuts. Just make sure there's nothing that you can confuse the site with when you go to check it later. Okay, so I'm going to check his arm. All right, perfect. I'm going to change my gloves and perform hand hygiene. Dispose of my gloves. Hygiene. And put on some new gloves. Okay, then I'm going to take my alcohol wipe and the arm that I was looking at and palpated and inspected, I'm just going to clean it in a circular motion at about 2 inches. I have to let that completely dry before I do anything. Same with the top of my vial. After I cleaned it, I need to let it completely dry before I put the needle in to draw up my medication. Okay, Mr. Smith, I cleaned your arm and I'm gonna get ready to go ahead with the injection. You have any questions before I start? No? Okay. So I'm gonna take off my cap. Make sure I have bevel up, perfect. And I'm going to hold the skin tight and I'm gonna take my needle bevel up at a 5 to 15 degree angle. I'm gonna go about 3 mLs in. So I'm gonna go ahead and do so. Awesome. I'm gonna stabilize it. I'm gonna actually push the medication in. As I'm pushing it, I notice a little bleb pops up, and that is completely normal for this type of injection. So now that I have already pushed the medication, I am going to get my gauze, put it over the site, and then just pull my needle. Don't put pressure on the site, just hold it right over. I'm gonna dispose of this into my sharps container. I'm gonna make sure with my patient that they're okay. Okay, Mr. Smith, you feeling okay? Doing anything wrong? Anything going on? Any questions? So on and so forth. Once I make sure that everything is okay, I'm going to gather up all my stuff. I'm going to throw away any trash that I might have. I'm going to document everything that I did according to the medication rights, form hand hygiene, and that's it. Thank you.